So we are really interested in this project to understand how healthcare workers, and by that we're defining healthcare workers really broadly because we want to include a lot of different kinds of people with different socioeconomic backgrounds and educational profiles. So we're interviewing physicians and heads of medical societies, but we're also interviewing their administrative assistants, and we're talking to nurses and patient transport officers and psychologists and social workers and EMT drivers. So we're really trying to get a broad sample of different healthcare workers to better understand how it is that they have been responding emotionally and ethically to this series of disasters that have been occurring. For our project, we kind of started in 2017 with Hurricane Maria, which we've just passed the 4th anniversary a few days ago of that hurricane. But certainly, thinking about the long-term financial downturn and the debt crisis that Puerto Rico has been suffering through could even be a kind of 4th disaster in terms of what we're looking at. So we're interested in Maria. Then Puerto Rico was hit by a series of earthquakes, which continue, but they really were quite strong in 2020. And now, of course, the COVID pandemic as well. And so as healthcare workers who are emergency responders are called on to keep giving and keep being there and keep caring for others during this kind of disaster upon disaster scenario, we're really interested in how do they find meaning and purpose in their work, and how do they sustain those kinds of efforts of continuing to care for others. At this point, we have conducted 100 interviews with healthcare professionals, and we're still in the process of analyzing all of that data. And so our findings are really preliminary, but I do feel comfortable saying that there's some themes that are super clear in the data. And one is that we were just really struck by how consistent it was that healthcare professionals just rose to the challenge of responding to these disasters and often put their work and caring for others above other kinds of priorities and responsibilities in their lives. Healthcare workers not only figured out ways to deliver care in extremely trying circumstances after Hurricane Maria, many without access to water, without electricity, with minimal communication, but they figured out ways to do what they could to meet their patients' basic needs and also resolve a lot of logistical challenges, whether that was making sure people had enough to eat or got water that they needed or found a way to get power for their medical equipment or get their prescriptions refilled. So there's been a lot of really amazing work happening on the ground by healthcare professionals. There's also been a lot of community organizing and new kinds of very grassroots responses to the challenges of Hurricane Maria. And these organizations were still active and were able to be mobilized for the earthquake response and now for COVID. So when we talk about some of the ways that Puerto Rico has been able to respond effectively to COVID-19, I think it is related to the kinds of infrastructure and organizing that people were able to create after Hurricane Maria at this very grassroots level. Because even though they've been super successful in that regard, we still need to think about the broader context of a structurally underfunded healthcare system, as well as a response at the federal level where only a small proportion of the money that was promised for rebuilding has actually been delivered. So folks have been doing this kind of amazing work on the ground in these incredibly constrained environments. And so that's some of the things that we're finding and trying to make sense of. On the one hand, we don't want to over-valorize this kind of heroic response because, 4 years in, people are getting tired, they're getting worn down, there's a lot of constant challenges. And it's, how sustainable is it to rely on people to keep having to give 120% in order to fill in structural gaps that are in the healthcare system? So we're hoping one of the outcomes from our work is to identify some of the knowledge and practices services that people are using on the ground, that we can maybe think about how those can be scaled up, how they can be incorporated more robustly into a more institutional kind of response. So we're not always asking people to give 110% to fill gaps in institutions.